your phone. Hi everybody, so welcome. This is our first Wellness Wisdom Talk. I'm Angela King and Clinic Director at Indian River Acupuncture and Functional Medicine, and I'll let Dr. Chris introduce herself.
I'm Chris Nielson, and I'm a physician and I do acupuncture here. A lot of you know me already.
Yes, and we're just going to continue to admit people. Thank you for joining as we see you come up. And what our plan is to do also, just so everybody knows, on Facebook Live and on Zoom, if you have questions about anything that we're talking about, feel free, if you're on Zoom, to chat them, put them in the chat, or at the end we'll turn your mics on and we can take questions one at a time. If you're on Facebook Live and you have a question for us, go ahead and type it in the comments, and we have Lisa, one of our office assistants, helping us to try to field questions. Thank you guys for joining. So first we thought we would talk about, let Dr. Chris, from a medical doctor's perspective, just talk about antibodies first. So we're going to discuss testing that we have here available at our office, both for antibody testing for COVID-19 and for infection testing. And our purpose here is just to try to fill the gap for people in terms of availability of these types of tests. We're hoping to we see that the government has passed a policy or a mandate that insurance companies should be covering antibody testing. But what we do, and we know that there's PCR testing available with the nasal swabs, but a lot of the issues is that you can, hang on, somebody's saying they can't hear us, so let me turn up the mic and see if that helps. Can you guys hear us on Zoom? Okay. So, you know that you have to meet strict criteria to be tested still. We don't have widely available testing, so that's one of the issues that we're facing. And also with antibody testing, we don't know how long it's going to take for that to be available to everybody en masse, and how many supplies are going to be available. So we have a limited supply, we can obtain more. So we're just trying to help people fill the gap between now and when this becomes available to the masses. So we're gonna start with just Dr. Chris talking. We're gonna talk about the antibody test first. And Dr. Chris is just gonna explain from a medical perspective what antibodies are and how your immune system works to generate those and what that means for COVID-19.
So if you've ever taken a virology course, you end up kind of being in awe of viruses, because they're really just a little envelope, a little bit of RNA, and a few proteins, and that's all it is. And the only way they can replicate is by getting into one of our cells, getting into the conveyor belt, and having our cells make more of them. So the way the body has adapted to fight off viruses is by detecting their antigens with our B cells. So the lymphocytes or the white cells or the B cells are all the same thing. They will find an antigen, detect it, and start producing a protein called an antibody that will stick to it. And it's almost like sticking a little red flag onto the virus so that the body now detects it. Before that, it was invisible. It got in, it could get into the cells, it starts replicating. It just kind of does its thing. But once we produce antibodies, and there's two kinds, one is the immediate kind, the IgM, then the body can detect it and kill it. And then we produce IgG a little bit later on. It's just a protein that sticks on the virus, and we have tons of it floating through our body just in case something that we've been exposed to before comes back in. So it takes us about 2 weeks or 3 weeks to produce a full complement of antibodies. The B cells mature, they go into the bone marrow, they're called plasma cells, and they're just spitting out like 1,000 antibodies a second, literally. So your bloodstream is just flowing with little antibodies, and as soon as they find a virus, they'll stick on it, and then here comes a macrophage to eat it, here comes complement to destroy it. So it just gives the body a little red flag so that, you know, we can fight it off.
So, and in COVID-19, what the data is showing us so far, what we've read, what we've studied, we've listened to webinars, we've heard scientists speak, the IgM antibodies in COVID-19 are typically elevating around day 5 and last through about day 15. So that is showing more of a recent infection. And then once you get out to a little bit past day 15, the strongest antibody response that they've seen so far for IgG starts happening around day 18. And this is when you what's called seroconvert from IgM antibodies to IgG antibodies. So IgG will tell you that you've had the infection, right? Your immune system has seen it, has likely now moved past the infectious stage, past the ill phase, and you will retain these antibodies, these IgG antibodies.
Years, yeah.
Right, and that's how long you retain them is up for grabs. No one really knows that yet. Virologists and scientists are estimating, you may have heard something on the lines of 1 to 3 years. I think no one really, I mean, the truth is no one really knows, and no one really knows yet quite enough about reinfection if it's possible, but we would at least suspect for a decent period of time, you're going to have immunity to COVID-19, to the SARS-CoV-2 virus. So that first window, though, in the first 5 days, that's when you're sick. That's when it's more appropriate to have the nasal swab or the oropharyngeal swab, pharyngeal swab, where you're detecting by PCR. Oh, hold on.
The camera's sideways.
Oh, so we have a little Facebook Live issue here. So how do I fix it? So maybe this has to like pull up. Hang on, sorry guys. Like we said, our technology skills
The phone is gonna fall.
are not.
Oh no, that's not gonna work.
Okay, so go back, and then I think we have to just rotate this. Yeah. We are good at medicine. Back to that. Wow, that was a close-up. So that first window of when you first contract the virus is more appropriate for those swabs. That's PCR testing. Okay, so PCR is polymerase chain reaction, and they say RT-PCR. That's real-time PCR. That's when they're actually looking for the RNA of that virus through that very detailed type of testing. Although that's the problem with any of these tests is that they can be false negatives and there can be false positives, right? So all the labs can do is do their best, right? And there's always going to be some false negatives, meaning it didn't pick it up, okay? So you had the virus, you got a swab, and it came back negative, but you really had the virus. That's called a false negative. False positive, that could be where you didn't really have the virus, but your antibody test or your PCR test came back positive anyway. More likely probably to happen on antibody testing.
Yeah.
So
PCR is the gold standard. It takes a lot longer, it's a little bit more expensive, but it's the gold standard. And if there is a virus in your body or even a particle of a virus, it will pick it up. The antibody testing are a much quicker test, a little bit less expensive, and then again, it doesn't actually test for the virus, it tests for your body to see the virus and form the antibodies. So you do it the later
Stage or even after you've had it. Like you can get it a month later and say, did I have COVID last month? It should show up.
okay, so can you guys? Sorry, Zoom, Facebook Live. So can you guys hear on Facebook Live now? We rotated the phone. I turned the volume all the way up. Okay, I see one clappy face. Now we can hear. Okay. We will have this nailed by Wednesday when we talk about Chinese herbal medicine help for COVID. We will have it down. We promise. Okay. So we were just for Facebook Live. All we were talking about right there was just that any test can give a false negative and a false positive. So that's just what happens. I mean, there's many details in laboratory science that contribute to that, but we're just okay.
needs to go.
your screen down.
What if we undo? Okay.
Can you hear any better now on Facebook Live?
Be blocked on that.
Maybe they need
No,
some
I know.
test-
Mandy's saying it might be blocked on the bottom of the phone. Zoom, can you guys still hear? Yeah, okay. Oh, I'm so sad with Facebook Live. I don't know what to do. No, it doesn't go. Like, okay, maybe if we bring,
Okay.
so somebody else is saying they can hear us back fine, and it's going back and forth. Okay. When you leaned in, we could
Hear better. Okay.
Okay, so here's what we're gonna do. We are gonna do our best, and we will try to record this and see if there's any way that we can get you guys like a copy for anyone interested. I'm sorry, we don't know why the volume on Facebook Live isn't working. We've done everything that we know to do, which is not that much. Okay, so we're just gonna keep going. I'm sorry for you guys that can't hear us. No sound at all. What? Okay, if anybody wants to hop over to Zoom, that also is a possibility. If anyone that's on Facebook Live wants to hop over to Zoom, whatever you did, undo it.
I don't know what we did.
Other than rotate the phone.
There's still a few people that
There's
can't
still-
hear, but
There's some people. Lisa, here's the other thing, maybe Lisa can just quickly post the Zoom link, and if anyone that is on Facebook Live and cannot hear wants to hop over to Zoom, that would be awesome. I'm really sorry, you guys, we tried to figure all this out before, but we don't know exactly why some people can hear and some people can't. Okay, so thank you guys, and I'm sorry, we'll figure it out better next time. I don't know why it's going in and out like that.
On your own phones.
That was me.
Or
Okay, all right, Lisa's gonna post the link, I'm so sorry. Okay, so here we go. Back to the testing, all right? So, let's talk about the antibody testing that we have, how that technology works now. So basically what they're doing, do you want to talk about the spike proteins on the virus and how?
Sure.
Yeah, okay.
Yeah, so like I said, there's lots of different, just a few components of the virus, and they have to develop an antibody test for the part of the virus that most people are going to form an antibody to. And there's a little bit of RNA in the middle, there's a little envelope, and then there's a spike protein and an N protein and something else. They pick
it's the most common thing, and
so we're only testing antibodies for
The N
the N
protein.
protein, because that's common. So it's possible that maybe your body formed antibodies to a different protein and,
won't pick up. But it's like 87%.
of people form antibodies to the N protein.
so, and that is called.
Called the sensitivity.
That is the sensitivity.
That's the sensitivity of the test. So when you see those numbers in any type of reports that talk about specificity and sensitivity, specificity is the type of the virus that you're detecting. The sensitivity is the level at which the lab can detect it. So that is differentiating, yes,
like a false negative or
between. So this particular test that we have is the colloidal gold test, which you'll see that methodology mentioned in the antibody testing. So they use colloidal gold as a tracer, and it goes and finds the antibodies and then lights up on the test when your serum is placed into the wells and of the test, and it will light up for either IgM or IgG antibodies, sometimes both. If you're in that phase where you're convalescing and you're moving from IgM to IgG antibodies, you may show positive for both. Okay, so this particular test right now that we're using is through Dunwoody Labs. Dunwoody Labs is out of Atlanta, Georgia, and they are one of the well-known functional medicine labs. There's also
KBMO Labs is doing antibody testing. There's a lot of our functional medicine labs that are doing this antibody testing and making it available. So the particular lab that we're using, Dunwoody, has secured theirs through a company called Ray Biotech, and Ray Biotech is also out of Atlanta. A lot of the antibody testing are coming through biotech labs. So biotechnology labs are the ones that are really making these in the United States. So you may have seen that there is like these fake tests coming out of China, or tests that didn't seem to be accurate that were imported here.
Yeah, a lot of them just were, everybody's scrambling. Everybody's trying to get the technology and get things put into place as fast as they can. And one of the quotes was, we're trying to fly the plane as we're still building it. So
That's why
everybody's trying to make a test, and some of them are not as effective, not as sensitive, not as specific as others. But we tried to pick one that has some background. And they're all trying to apply for FDA approval. There's about 70
Yes.
in the line. Only one so far has been given emergency use authorization, but we're hoping
that they'll kind of get through that backlog.
quickly.
Yes, and the one that we're using has been submitted for emergency use authorization back on March 16th, and it's still waiting, but it does have the same technology as the one that has been approved. That test right now, for the cost of that out of pocket, for those of you that are wondering, the fee to the test is $145. The cost of the test is $120, and then for us, for our office, the $25 fee is for the processing, for the lab review, for us to call you and tell you what your results are, and for us, frankly, to try to keep our doors open and keep our business running during this time. We're still paying our 2 full-time front desk people, and we're doing our best to bring this information to you. We are researching constantly. We're on webinars. We're learning. We're staying up to date. So that's a way that we are also trying to help everyone, and at the same time stay open and keep our availability to you the best we can. So,
Oh, and one other thing is this antibody test is a serum blood test. So you have to
Yes.
get blood drawn either at, I think you said physician lab data.
yes. Okay, so yeah, it's a serum blood draw, and right now we have a concierge phlebotomist that if you just do not want to go into the lab, she is available. She comes to your house in full, mask, gloves, the whole 9 yards. It can be done on your front porch. It can be done in your garage. She does not have to enter your house. She's a concierge phlebotomist that we've used for a long time for a lot of our lab tests. Her lab fee is $50, so that would be for her to come to your house and submit it. Or Physician Stat Lab is the other lab that we're using here, which is actually right across the street from our office. For those of you that are local, their draw fee is only $10, and so you can just go right across the street. There's no fasting for this test. You can have it done at any time of the day, but that means you do have to go get your blood drawn. So those are 2 options that we have for people to be able to get that antibody test done, whether in their own home or whether going to the lab. Okay.
And I think that's all we had. We still
Cool.
offer the viral test, and that's the swab that you put in the back of your throat, and you can do it at home and then mail it in.
Yeah, so let's just say a little bit more about that. The PCR testing, if you do become sick, okay, and, I want to back up for a minute. So why would somebody, let's just nail home why somebody would want to get an antibody test, okay, because I think that's important. This is a test that's really for people to feel more safe about going back out into the community, or if they're working, going back to work. This would help them to feel more safe that they have either A, had the virus, okay, and either had a very mild version of it and didn't even hardly know that they were sick, or maybe they just thought they had a cold. B, a lot of people are wondering if this, virus could have been here in the United States before, we officially had the first case in January, I think. So some people are saying, oh, I had such a really bad cough back in December. I was sick for such a long time. It was like nothing I ever had before. And so there's a big question mark if maybe perhaps they had done some overseas travel or been somewhere where the virus was ramping up, and perhaps it was COVID-19. And so this antibody test would tell you if that cough that you had, that sickness that you had back in January, December, even early February may have been COVID-19. That's another type of a group of people who are interested in getting the antibody test, right? The other group, so this is the third group, would be people who may have been asymptomatic carriers. The last statistic I saw on that was like 20% of people, I think it was, could be asymptomatic carriers, okay? So that means you will never have a symptom, no symptom. Asymptomatic means no symptoms at all, okay? You're just carrying the virus around, right? You're not sick, but during that phase of viral replication, you could still infect others, okay? So, but the virus still runs its course in your system as an asymptomatic carrier, so eventually those antibodies would form in the same way, and you would know if you were an asymptomatic carrier by testing positive for COVID antibodies. So that's really the three type of people that this test would make sense for, and people who want to feel safer about getting back in the community. Also, of course, if you have the antibody test and it shows negative, right, then you're going to know I have not had exposure to this virus. If I am in a high-risk population, whether that's an elderly person, whether that's someone with comorbidities such as diabetes, hypertension, obesity, asthma, pulmonary disease, the big comorbidities that we know make you at higher risk, you would know that you really still, need to protect yourself. You need to continue to take these precautions, as right now everyone does, but especially as we move more toward opening up the economy, the businesses, that sort of thing again. Okay, so the last thing we want to say is about the PCR testing. So that is if you become sick, high fever, fever, although some people don't have fever, this virus is very strange, right? So fever, all viruses are strange. There's differentiation all the time, or differences all the time. So fever, cough, certainly what happens a lot of times that we're seeing is people feel sick and they're scared that it's SARS-CoV-2, but they don't have a way to get tested, right? Because they don't meet those criteria. And in the beginning, the criteria, they've been very strict. It's like you had to have traveled outside the country or traveled to an area that's got a high number of cases. You have to have been in close contact with someone who's got a confirmed diagnosis of COVID-19,
But we don't, for the tests that we have any criteria.
Right. So that's why people haven't been able to be tested, because they weren't meeting those criteria, right? Even if they were ill, so or mildly ill. So now with these swabs that we're doing, this is a swab that you can do your best to get your throat swab, and it will instruct you on how to do it, and then you mail that back in, and the results should be back within 4 to 5 days.
Sometimes longer.
Sometimes it's taking a little longer. Oh, let me go back. The antibody tests, those results are uploaded into our portal 24 to 48 hours after the results. So the antibody tests come back very quickly.
So yeah, so PCR is
Gold standard.
takes longer, more expensive. It's like $249.
Yes.
But if you can do it at home, then the antibody test is only after you've had the sickness or
You're midway through the sickness. It's
100
$45 plus a lab draw fee.
either at home or at a lab.
Okay. So, and let's see, we were going to just say, also testing just helps in terms of public health initiatives, right?
More data. We need more data.
Right, to know in the community who has it, what the incidence rates are, and that can help everybody get back to what our new normal will be after this. Let's see. Okay, Sally, I think we answered the question about the total cost. Is there anyone else, let's see, that has any questions that we can answer about this right now? While we wait to see if anyone else has questions. So right now, our office is planning to do these wellness talks. We have a lineup right now all the way through May. We're excited excited. We've wanted to do this for a while, but this is giving us the push to do it. On Wednesday at 4, we're going to do Chinese medicine herbal health for COVID-19. We're going to talk about what was done in China on the front lines, what herbal medicines were used and how they can help, in what various stages of the illness you would use them in, that sort of thing. The next Saturday, we're going to talk about functional medicine strategies, so we're going to get into supplements, recommendations, dosing, all that kind of thing, and then we're going to go by the IFM or Institute for Functional Medicine guidelines that have been published as well. And then we're going to do gut health, we're going to do emotional stress, and how we can help support you during the stressful nature of this time. We're going to teach you an at-home technique to do, and we're going to talk about Qigong breathing, Moxa, all kinds of things that you can do. We've got a whole lineup ready for you. Let's see, we have a couple questions. The procedure for getting a test and the price again. Okay, so let's just review that one more time. Just for a test, all you would do is call our office, and the procedure that we've been doing is you call the office, and then we will, if you're a current patient, all you do is come pick up the kit. We've been maintaining our office for the last month of just us that have been in here, and all of us are social distancing or physically distancing with our own families. And then you call if there's any payment due. We do that over the phone, and then we set the kit right outside the door, and then we go over the instructions with you on the phone. If there are anything else that you need to know that we haven't been clear about. So that's, if you're not a patient currently and you would like to do a test, all we have you do is fill out a brief, very brief, like demographic information and HIPAA forms, because this is a medical test. We are responsible as licensed healthcare practitioners for the information, so you have to be on record, but it's literally like a couple forms, and then the same process happens after that, and we'll call you with the results. And the price again for if you're sick, that's the PCR testing right now. The least expensive that we're able to get it for our patients is $249, and then the antibody testing is $145 plus the either $10 lab fee if you go to the lab, or the $50 lab fee if you choose for the concierge phlebotomist to come to your home. Okay, let's see, we have, can we send the info on Wednesday Zoom to people elsewhere who are not clients? We would love for you to, absolutely. And because people in other parts of the country may have Chinese medicine practitioners or herbalists who can help them as well, so they just need to have the knowledge to seek it out, right? If you don't know, you're not going to be able to act on that, right? And so, yep, so let's see. Is there anybody else that has a question?
Yes, Angela and Dr. Chris, can you hear me?
Yeah, I can hear you.
Okay, can you all explain when you're immunosuppressant, how the virus attacks and because you're not able to fight it off? Can you explain that process?
Sure. So the different medications that cause immunosuppression act on different elements of the immune system, but your body is still able to make antibodies. Yeah, the B lymphocytes are still out there working. They still have antibodies on their own surfaces, and they're still able to produce
Antibodies,
but there are certain elements that are hindered, like maybe you have less lymphocytes, or maybe you have a little bit less complement flare, or there's certain things that are just
diminished. But yeah, you still make antibodies.
antibodies, and you can still
good.
the levels would still be detectable by a test.
And that would also go for other people who have suboptimal immune responses. Like, for example, most people know I have Lyme, right? So in my case, I did a test long before this, and my natural killer cell count is low by the lab standards, okay? So I'm compromised slightly in that part of my immune system, but I'm doing a lot of strategies that are out there to enhance that particular aspect of immunity. That is not the only. There's the natural killer cells, there's the T cells, the B cells, there's the mucosal lot of different functions of immunity and different things that we can do to enhance that. That is actually, we're going to go into that a little bit more next Saturday at the same time with the functional medicine strategies. We'll get a little bit deeper into that and how these supplements have evidence-based research behind them to enhance these different aspects of immune function.
Yeah, we have a very redundant immune system.
There's lots of layers of
Lots of like backup systems.
Yeah, so you're not without any immune function at all. Okay. We had one more question. Do we send an order to physician stat lab? No, that's a good question. It's an actual kit. Hold on, we got to admit. It's an actual kit that you pick up here at the office, and then you just take the kit over. They draw the serum, and it gets mailed off. It's a very simple test, so no, it does not need an order. It just needs the kit. Okay. Quercetin, I see a question about that. Yes, we're going to talk about that next Saturday in great detail. Yeah, quercetin is recommended by IFM. It's an anti-inflammatory agent, and it works really well with resveratrol and a couple of other things, but we're going to go into great detail about that next weekend. Okay, so I think everybody's asked their questions. We thank you for joining, and on Wednesday at 4 p.m., that's when we're going to go into detail about the Chinese medicine approach. It's really fascinating, honestly, what they've done in China. Like, let's, politics aside, okay, let's forget about that. We're here to talk about the medicine part. And what they've done in China has been really remarkable. 92% of patients there received Chinese herbal medicine in addition to Western medicine, or the hospitalized patients. And their recovery rates were significant. So we're going to get into that on Wednesday, and then next Saturday will be the functional medicine side of things. So we're going to try to get this technology worked out. Thanks for putting up with it. I see one quick question about N-acetylcysteine, NAC. Yep, we're going to talk about it next Saturday in detail